So first of all, it's about the grammar portion. We have tenses, sentences, and parts of speech. Let's start with tenses. So what we have, let's say, apart from the fact that where to use which thing, what tense should we use and on a very basic level in the introduction. So mostly we can use the present simple tense. Most widely used tense is present simple tense. For example, I can write it down. Thank you for seeing, okay, Mr. whatever, put comma, a 38-year old, let's say accountant, if the profession is important, right? Either we can write down comma, whose, let's say, signs and symptoms are suggestive of dash for further management. So let's say if you can see in this letter, the introduction, we have just used the present simple tense. So most of the time in referral letter, you will be using present simple tense, right? Most of the time. But it's not the case always. Sometimes we can write down, as we can see yesterday, day before yesterday, we discussed about the referral letter with category of, you can say, without a diagnosis. So let's say if I'm writing this letter, the same letter, let's say, thank you. I will try to summarize it down. For seeing Mr. whatever or Mrs. 38-year, maybe, old lady, person, whatever, not lady, 38-year-old, let's say accountant, okay, who presented with white lower abdominal pain, right? So I would appreciate if you could further investigate for a definitive diagnosis followed by management, right? So you can see in this letter the first phrase that we have written in the past simple tense, right? So what we have seen in the introduction of the letter, practically we have seen that we can write down either present simple or past simple. This is the practical thing that we can see in your letter. Okay, so few example I'm writing it for you so that you can better understand that how can we organize our letter in view of the tenses. Now these are the example of referral letter. So I can write down the discharge letter. Normally in the discharge letter, again we can use the let's say part of introduction in the past tense and part of the introduction in maybe future or present tense, depends. For example, you can write it down. I'm writing regarding whatever the patient name is. I'm writing regarding blah blah person who, let's say, underwent a successful, if it's knee replacement surgery, right? Total knee replacement surgery, right? Full stop. He is due to be discharged today, or maybe he is being discharged today, or maybe if it's not today, he will be discharged tomorrow, let's say. So these are few circumstances that we can encounter with the grammatical example. We can see that this is past simple, underwent, sorry. This is past simple, and this can be in the present tense, and this can be in the future tense. Let's say now we have a practical example to use different tenses in the introduction part. Now, while discussing the you can say tenses part, there is one rule for the relative clause. I can also discuss that. If I am writing this sentence, whatever tense it would be, thank you for seeing Mr. Alex, let's say, a 46-year-old accountant. We can use comma afterward because after that I'm going to use the relative clause. I'm going to tell you the law for that. Thank you for seeing Mr. Alex, a 46-year-old accountant. Let's say who, uh, let's say whose the same sentence, signs and symptoms, let's say, are suggestive of diabetes mellitus, right? For further management, let's say. So we can see that we have used these two commas because in this sentence, this relative clause, whose sign and symptom are suggestive of diabetes mellitus, is basically, you can say, a non-defining relative clause, which means that if I can even omit this sentence, this will be a complete sentence, right? It will not be a weak sentence. However, if I will be writing this clause in this approach, let's say mellitus, then I will put full stop. If I finish the sentence over here, like I'm writing to thank you for seeing Mr. Alex, a 46-year-old accountant whose sign and symptom are suggestive of diabetes mellitus. Let's say if I put full stop over here, then I can write down, I would appreciate if you could further investigate, or I would appreciate further management. Okay, whatever you are writing. So these are example of the rules of grammar that we can impose in our structure of writing. So first we discuss about like two types of tenses can be used in the introduction. Now we discuss about a relative clause rule. I hope it's in the second body paragraph, or when we are writing about the past history, it's depend upon wherever you are writing, right? So wherever you're writing, we can you can say which tense. First of all, we are describing this thing. Okay, so we can see that in the past history part, we can use the maybe sometime present simple. Let's say, for example, he sorry, my gosh. For example, he has a positive family history of diabetes, right? And again, with a positive family history of diabetes, right? Now we can see that it's a present simple tense. Let's say he has a 4 months. Sorry, he has, let's say, uh, A history of hypertension, however, it is well controlled. Let's say. So again, the present simple tense. Okay. We can also write down. Let's say he is a smoker, drinker. So everything you can see the personal history or the socioeconomic history associated with the problem or the person is written in the present simple tense, right? Okay. Sometime there are some history that can be written in the past tense. Okay. We can also write down she's a history of blah blah problem, or let's say he underwent blah blah surgery. So if it's related to past, we can write it down underwent. One rule that we understand that with the word history, we never use the past tense. We cannot use had with the word history. The word history, remember that. Okay. And importantly, like while in the introduction part or in the history part, we can use, you can say, these two tenses like present simple and past simple most occasionally, right? Now, if we have to mention the risk factors in the socioeconomic paragraph, like the second paragraph or the second last paragraph, it has also been written in the present tense, mostly in the present simple. For what? The risk factor. Let's say he is allergic to morphine. Let's say as he is overweight and family history. He does not do an exercise. Okay. He lack uh, of regular exercise causes this problem. For example. Okay. So we can use these tenses in the history part. Okay. So is it clear? The treatment or the management we do write normally in the body paragraph. It's normally written in the past tense or specifically in the past simple, most oftenly. Oh, come on. In the mostly in the past simple tense in the treatment part, but can be used in the past perfect tense. Okay, but as you can see in writing a referral or discharge letter, we can write it down. Let's say Mr. X presented on, let's say, blah blah date with whatever complaints of. So past simple can be used. Then he was given past simple tense, or consequently blood test reports were ordered. Again past simple. So you can see the most commonly things that we use. He was advised. If we have management, he was advised. You can use in the past simple tense. Okay. Or let's say if we have the treatment, let's say you started the treatment, for example, paracetamol, or maybe any medicine, XYZ medicine was prescribed. So in coherence, we can write it down and the effect of the medicine together with that. However, right, it was not effective. So right away, we have written the effect of this medicine. But both of the tenses are in the past simple tense. Okay. So this is the rules and regulation that has to be implemented in the portion of the grammar. Now moving on toward when we have to in the body paragraph, let's say in this part, maybe if it can be divided into two paragraphs, the recent history, that is either today's visit or discharge plan mostly. But let's start with the recent history in the referral letter. and the past treatment record from all the visits. So when we have to differentiate two events in the past, when we have to differentiate two events in the past with reference to today's visit. So a simple rule that must be learned for near past, again, we use the past simple. And for far past, we use the past perfect. So at the moment, like when we are writing in a sentence, I'll explain it to you. For example, if I would write two sentences, she was on OCP for 4 months, let's say. OCP stop, let's say, and not able to conceive. If it's written in the case notes. So what we can write apart from the clauses, we can manage it. We can simply write down, let's say, yeah, despite stopping, yeah, despite she stopped. So in this sentence, we can see there that we have used the had been taking. It was in the past perfect, and she was not able to conceive after that event. Let's say it was in past simple. So when we have to make a comparison between two events, the far past event will be in the past perfect tense and near past in the past simple tense, right? So this is an example that we use in mostly the body of the letter. Now let's begin with the today's letter in the referral. Today's letter again, either we can use the present perfect tense or perfect continuous. Why? Because there is something that might be like running from the past visit, and in the today visit, either it's ended or it's still continue. For example, if there was pain for 2 weeks back, you gave some medicine, and today he came again either with increased pain or decreased pain. In both scenarios, we can use has. His pain has increased. Despite he was given painkiller, his pain has increased, right? Or his condition has improved. In today visit, we use the present perfect tense, first of all, or present perfect continuous, depend. And similarly, in today visit, we can use the past simple tense. Let's say we can simply write down today he presented with. Like say today his reports revealed that. Let's say we can use the past simple tense and simply today he presented with the similar symptom. Okay, like that. Or uh, his test, let's say, revealed. Why? Because at the time of writing this letter, this has already been done. It's a near past. Now, apart from that, we can use the you can say tense. For example, when you're writing examination in everything, anywhere. For example, on examination, either it's in today or past visit. Okay, let's say there was blast, let's say whatever. On examination, he was having tender tenderness, let's say like that. Or on examination, he was having shortness of breath, let's say. So these are few examples that you can use, or simply we use normally examination was unremarkable, right? You can use this line. Similarly, if we have the you can say some other specific system examination, we can use the for example, bilateral freckles were appreciated on chest auscultation, right? We can use this abbreviation. Now, if we have some investigation or some readings for some test, so we can write it down in the past once again. Let's say the ECG detected, like again the past tense. Okay, yeah, ECG was normal in the past tense, right? Okay, or it can be written, let's say blood test was normal in the past tense. Similarly, the investigation, let's say X-ray indicated no fracture, let's say. Okay, so and we if we have the results, we can use the present tense now. For example, um, if we have the result, for example, uh, let's say mm, let's say in view of his investigations, we are respecting AMI. So I'm using R. Okay, investigation. You can write it down. Whatever investigation you're writing over here, confirms blah blah blah. Okay, is it clear to you? Okay, so now we have the few examples that we discussed from the some of the lines that you can use, the closing lines when you are closing the letter. So we can use this line. Thank you for, let's say, the discharge letter, continuing care of whatever, and I would appreciate, let's say as well, your, let's say, home visit. If you are referring to someone who has to pay a home visit for Miss Mr. XYZ for, let's say, the provision of palliative care. So again, you can see that this should be in the present tense. Is it clear to you? For example, the mostly widely used tense is present perfect tense, right? That we discuss first that which paragraph we should use which tense. Although it should be open, like in your writing, it should be, like you should be writing the letter with flow. But just to give you a brief idea, because letter can guide you, which tense should be used. But let's say, how would you know I have to use which tense? This the rule is something started in the past and just still continue till the present. You can use the present perfect tense. Okay? Or if something we have started in the past and is continuing today's date. Let's say his condition has improved. Let's say, let's say if we can write down in this sentence, his condition has improved, it means that he might be taking some medicine. So let's complete the sentence. He was given blah blah medicine. Consequently, his condition has improved. So this is related that his condition or pain started in the past and is going to improve in the present. Okay, and it's a progressive condition. He has been, let's say, having diabetes since 2004, or he has had diabetes since 2004. Both are right, right? Is it clear to you? So there are some rules for the present perfect tense: when to use since, when to use for, and when to use our. So let's say I just have given example. When we have start of time mention, we use specific. For period of time, we can use since. And for the similar, we can say event that is happening time and again, or repeated event. We can use our. So let's write three examples for that. Let's say Mr. Alex has been having abdominal pain for 2 weeks. Let's say we can also write down Mr. Alex in present perfect tense has been in pain for 2 hours, right? And it since Mr. Alex has been in pain since, let's say, 12 a.m. You have specific time being mentioned. Or Mr. Alex pain, whatever pain, let's say abdominal pain, whatever, kidney pain, has worsened over the last week. So these are few examples of since, for, and our. Frequent errors we use, let's say, the frequent errors we use, he is diabetic since 2004. This is wrong sentence. Frequent errors. Let's say we use he is drinking 5 drinks per week for the last 3 months. Again, it's wrong. We cannot use is before and since cannot use if, right? These are some common errors. Okay, so we have to see which tense should be used accordingly. That she had noticed blood in her stool, maybe uh, twice in the last week. So we can use the present simple and past perfect together. Okay. Can we can use this past simple to the present simple tense, present perfect tense. Let's say he has been having asthma for 6 years. Let's say can be written interchangeably. And let's say if you can write it down, let's say he initially visited to my GP in 2001. So I can write it down. This sentence can be changed. He has been visiting to my GP since 2001. You can see that we can change. Okay, you can change the sentence from each other. Okay, let's say the patient, if the past simple, did not respond to treatment. You can write it down. The patient should be written full, has shown no sign of improvement up to now, if it's the present tense or yet. You can use that simple past or present perfect can be used interchangeably. Have to use the articles. We use are, and the. With a singular countable noun, we can use are or an. Let's say he presented with a complaint of abdominal pain, right? Or he reported a lump, let's say like that. Okay, we can use that Mr. X is an accountant, can be used for the articles over here. If you are asking for, let's say he requested a painkiller. Give example. No, he requested a painkiller. Okay, so few example that you can see. He requested a painkiller in this part, or he had reported a tingling sensation. Let's say like that. Or Mr. Mark is a doctor. Let's say we can use "a" with that. A teacher. A blood test was ordered. Right? We can use "a" with that. With uncountable noun that we cannot count, we cannot use any article. We have to use "the" when we have to mention something specific. Let's say with the body parts. With the word like similar, following, you can use the. He presented with, let's say, with pain in the right shoulder or in his right shoulder can be written. Okay. We can also use that Let's say this medication need to be taken, let's say twice or thrice for the next 3 days. When you have to specify something, you use article the. Let's say with body parts, we use the, and when we have to specify something. Name of disease, mostly common error again. If until unless if it's not name against scientist, we can use the capital letter, and there is no article. You should not use a or an before the disease or the as well. And similarly for the capital letter, for the diabetes we use small d, but for Parkinson we use P capital because it's the name against the scientist. So you have to see this thing as well, that we should not use article before the name of the disease, but it should be capital in case if you have Parkinson, or small in case if you have diabetes. Okay, we can move on. Let's say uh, we can use the you can say the with the word same. She presented with the same complaint, with a similar complaint. We can use the. Is that okay? Is it clear to you? Now, rule of capitalization. Which we use? If we have the brand name for medicine, we use capital letter. Number one. Okay. If we have the salt name, we use small letter, lowercase. First letter I'm talking about. Name of disease we already discussed, right? The medical procedures. If it's not common proper noun, we use lowercase, small letter. X-ray, C-section. Okay. Body parts, we use small letter. Okay. For mentioning something specific, let's say the job titles can be written with article the consultant, like say the cardiologist, the endocrinologist, let's say we can use the with that. And the name of place of institution, for example, Shifa Hospital, can be written with the capital letter, let's say. Okay, Newtown Hospital. Okay. Flights can be written with the, you can say, capital letter. Places, address can also be in the capital letter, right? Okay. The title of the person, the first letter could be capital. Let's say Dr. Smith. You can use D capital. Okay. And the common noun, we should write it down with the small letter. Like she's a teacher, she's a doctor, the small letter. For the common days, special days, for example, Christmas, right? It should be capital. The months such as January, February, it should be capital. Okay, days even Monday, Tuesday should be capital letter. We should use them in a capital letter. Something from the sentences part, we have complex, compound, and simple sentence. I'm starting from complex sentence. We have a rule that there will be one dependent clause and one independent clause, right? So we are going to discuss specific things. There are different clauses that we are using. Clause of contrast. Let's say there is a rules for that we have to use. We have clause of purpose, or and we have clause of reason. Okay, so let's start with purpose clause. In the clause of purpose, we have to contrast between two things. So there are few things that can be used, like although, despite, in spite of, even though, right, while, however, can we use? So let's say, to give you an example, let's say, although he was, or although he had been attending physio for 4 months, or although he had attended, like very past simple, he had attended physio for 4 months, his pain did not improve. Now, although he had attended physio for 4 months, now this is your, you can say, dependent clause, and this clause is independent, right? We can simple even write down, even though he modified his diet, right? His weight has not reduced, right? So we can see that even though he has modified his diet, his weight has not reduced, right? Relative. Okay.
Sorry,
After
even
we used
yes,
the
yes.
same sentence in different approaches as per the requirement of the sentence. Even though he modified his diet, his condition has not improved. Can be written past simple and present perfect. And now present perfect and present simple. Even though he has modified his diet, his condition is still, yeah, he's still overweight, right? Sorry.
Mm.
Is it clear? The next clause is clause of purpose. Now, in terms of clause of purpose, we have something to express a certain action which has to be taken in the past and why this action was needed and has to be taken in the future. Let's say, in order to reduce weight, let's say a low fat diet has been recommended. And we can write it down vice versa as well. A low fat diet has been recommended in order to lose his weight. Okay? In order to, let's say, uh, we can just write it down. In order to allay her suffering, she was offered psychological support. This is clause of purpose. Now we have clause of reason. What we can write in the clause of reason, for example, due to and because, let's say due to the fact that he was overweight, let's say he was advised to modify his diet, like that. Okay, because there was an evidence of his poor compliance, he was advised Webster pack. Okay, and there was evidence that he's under severe stress. For this reason, he was referred to a psychologist or psychiatrist, right? These are some of the example of the clause of reason. Now we can write the clause of time as well. Let's say at the time of admission. These are the clause of you can say time. We can also use while he was in the ward. Let's say he fainted twice, like that. Okay, we can write it down in the time of clauses as well. His review visit was scheduled after 2 days. It's also a time of clause. Even though while waiting in the lobby, the patient fainted. Time of clause time, right? Is it clear to you? Now we have compound sentence when we have to use the conjunction to make the sentence together. Let's say he is a smoker and drinker. Let's say she does not smoke, however, drinks alcohol only, or but drink alcohol only. Sorry, right? We can use this as a like example for compound sentence. And simple sentence is a smoker is a simple sentence, right? Now we have to understand the concept of parallel sentences. Now, what are the parallel sentences? We can use the same form of the verb or the noun or the gens or preposition. Like say, for example, I'm writing. Let's say he is now overweight as he lacks exercise and eats junks. In this sentence, is lacks eats with the active verb in the present form and in active voice. We can write it down during, let's say, his ward stay. He was administered, let's say, blah blah thing, or let's make it more complete sentence. During his ward stay, he was his ward stay. Blood transfusion was done. Let's say, and let's say, and let's say, transdermal patch was used for his pain. So with the passive verb, thus can also be used. Similarly, these are some of the example of the parallel sentences that you have the same form of the you can say verb in your tense. Okay, the rules of comma. If we have the adverbial phrase that can be divided into context, maybe did, and if you have to emphasize. For example, starting from the context, let's say on the physical examination, put comma. Let's say there was a slight tenderness, like that. In any case, when we have dependent clause used first and independent afterward, we use put comma over here, right? This is the sum of the rules of the comma. Okay, and with a positive, when we have to use a positive noun, we have to put the comma. Let's say Mr. X, a 20-year-old. This is a positive noun. An accountant, a positive noun, right? In a conditional sentence, when we are using a conditional sentence, we use comma if your sentence starting the sentence with if clause. Let's say if you have any further queries, put comma. Please do not hesitate to contact me. But if you are using if sentence in our here, no comma. Like please do not hesitate to contact me if you have any further queries. Okay. Similar example are in case of pain, please administer this thing. When the result will be available, I will forward to you. So when we have dependent clause first and independent afterward, we'll put comma. Not we not use comma in the slip order. Okay, and these are some of the rules regulation that we have to follow. Tense verb agreement, sentence verb agreement. These are very minor thing, but just to cover in this class, the same sentence follow the same noun. We cannot use that. Let's say the switcher has been removed. If it's a singular form, we can use the switchers have been removed, right? Blood test with singular reports is available, or blood test reports are available, right? If you are using R with that. Two errors that people make: complaint with T versus complain with N. So complaint with N is a verb and T with the is a noun. So when we already have a verb in a sentence, we use T. Let's say he presented with a complaint, now with T. But we don't have the verb. You can use he complained of pain. So according to the importance of the sentence, we can change either he presented with a complaint or he complained of pain. Okay, so complaint with N is a verb and complaint with T is a noun. So you have to be careful in your usage of complaint, right? Now we can see there are some of the examples. Okay, there are some words that we commonly use. Let's say suggest, recommend, advise. So there are some rules for them. Let's say people write down this sentence: I have suggested him to see you next week. So we suggested it's wrong. You can write down I have suggested that, not with him, I have suggested that he see you next week. Okay? And if you want to replace this thing with advise, we can use with him. I advise him to see you next week. Okay? The word suggest and recommended must be followed by an object pronoun. The word suggest and recommended basically cannot be followed by an object pronoun such as him or her. Sorry. Like suggest and recommended, we cannot use him after that. However, we can use that after that. This is a common rule that you should remember. The word suggest and recommended cannot be followed by an object pronoun such as him or her, whereas advice can. We have a difference of explain versus tell. Whenever you are using explain, we can use I explain to them rather than I explain them. However, we use I told them. Remember that. We can use I explained to them and I told them. Similarly, advice with C versus advice with S. With C is a noun and with S is a verb. So the rules we already discussed that when we have a verb already, we are not going to use it. I advise him. Correctly, we are using is as a verb, so we use S. I have given him advice. Now we can use C. The difference between request as a verb and as a noun. Let's say the patient requested painkiller. Now we are using request as a verb. The patient requested painkiller. Then you are using as a verb, right? Now we have second sentence. Then we can see when we are using as a noun. The patient made a request. Okay, for painkillers. So these are a few of the chunks that we discussed. We discussed about tenses and which tense should be used where in introduction, in body paragraph, and like say in conclusion, and in discharge letter. In the discharge plan should be followed with the conditional sentence in a future. Like discharge plan, let's say, should be used in the future tense with would rather than will. We discussed about sentence, tenses, articles, and how and their usage would be done. There are some grammatical rules we already discussed. I hope this will be a fruitful class for you.